Hi, everybody. I'm Brittany Lewis, a breaking news reporter here at Forbes. Joining me now is Congressman Ami Bera. Congressman, thank you so much for joining me.
Yeah, thanks for having me on again.
I want to talk about President Trump's budget plan and specifically a real point of contention from lawmakers on both sides of the aisle, and that is the fear that there will need to be cuts to Medicaid in order to pay for the president's agenda. The Democratic Doctors Caucus held a press conference voicing their concerns about potential changes to Medicaid. You were in the caucus, you were at the press conference. Can you talk to us first about the group and the message today?
Absolutely. So there are now 6 Democratic members of Congress that are doctors. I think there's 12 Republican members. And as Democratic doctors, we feel like we've got a moral responsibility to step out there and talk about what potential cuts to Medicaid would mean to America's patients. And again, when you put that white coat on, folks trust you, and it is our responsibility to give the Democratic side of this. Now, we also know in private conversations with a lot of Republican members, they're very worried about what potential cuts to Medicaid would do. In many of their communities, the rural hospital is the biggest employee and is vital to the survival of their patients. And many of those hospitals would be severely challenged, potentially close if these cuts go through. So we are also making sure our Republican colleagues understand that.
I mean, you have a really interesting role here, having that background in medicine. What do you think then, with that doctor's perspective, is missing from this national conversation when it comes to potential Medicaid cuts?
Well, so it's important for doctors, nurses, long-term care providers to get out there and talk to their members of Congress, not here in Washington, D.C., but back home, and make sure they understand the impact if, potentially hundreds of billions of dollars get taken out of the Medicaid system. Patients are going to lose care. If they put work requirements in place, patients are going to lose access to care. So we can say this not as members of Congress, we can say it as doctors, but we also know we're members of Congress, so we have the responsibility of voting on legislation like this. So we're out there every day talking to folks.
I mean, you mentioned something really interesting, that in private conversations, Republicans are concerned about these Medicaid cuts, and there is reportedly a real point of contention between more moderate Republicans as well as more hardline Republicans in the House. Do you have any insight into those conversations? I mean, what do these conversations look like behind closed doors with your Republican colleagues?
Behind closed doors, so one of my California colleagues, David Valadeo, over 450,000 of his constituents get their health care on Medicaid. He knows that we along with other outside groups are in his district making sure his constituents know about this. And we've seen him come out publicly saying he won't vote for Medicaid cuts. Now, if he reverses that and does vote for it, that would be a damaging vote for him. He voted for ACA cuts in 2017. He lost his seat in 2018. So I think he's someone who truly understands that potential. But we're doing that around the country. A lot of this is playing out in public. The Freedom Caucus folks have demanded Medicaid cuts, and they've written a letter to Speaker Johnson. The moderate Republicans have said, hey, don't cut Medicaid, and they've written a letter to Speaker Johnson. So you can kind of get a sense of the tensions inside the Republican conference.